Welcome to this module on the fundamentals of nursing, a discipline built upon the critical integration of compassionate care and rigorous scientific principles. We'll outline the core competencies that every healthcare professional must master to ensure patient well-being and positive clinical outcomes in any medical setting. The learning objective is to understand how the pillars of assessment, safety, hygiene, and medication administration form an interconnected system. These principles are not merely a checklist of tasks, they are the foundation of professional accountability and clinical excellence, guiding every interaction between the nurse and the patient. The first principle is the synthesis of the art and science of nursing. The art involves compassionate, patient-centered interaction, respecting patient dignity, and providing essential psychosocial support. It is about seeing the person behind the diagnosis and ensuring their emotional and mental needs are met alongside their physical ones. Conversely, the science is grounded in evidence-based practice. This requires applying deep knowledge of pathophysiology, pharmacology, and clinical assessment to make informed, safe decisions. Nurses must stay updated with the latest research to ensure that the care they provide is effective, modern, and backed by clinical data. Effective nursing care requires a seamless blend of both elements. Science without compassion is mechanical, while compassion without science is unsafe. This module emphasizes that professional excellence is achieved only when a nurse can balance technical proficiency with a genuine, empathetic approach to every individual under their care. The second pillar is baseline patient assessment, primarily conducted through the monitoring of vital signs. These objective measurements include temperature, pulse, respiration rate, blood pressure, and oxygen saturation. Together, they provide a real-time snapshot of a patient's physiological state and serve as the starting point for all clinical interventions. Monitoring trends and vital signs is critical for the early detection of clinical deterioration. By observing changes over time, nurses can evaluate a patient's response to treatment and provide vital information for diagnostic processes. Catching a subtle shift in heart rate or blood pressure can often prevent a medical crisis. The third fundamental is patient safety, guided by the principle of primum non nocere, or first, do no harm. In practice, this encompasses a wide range of protocols, including accurate patient identification and maintaining a hazard-free clinical environment. Safety is the lens through which every single nursing action is evaluated. Safety also involves proactive fall risk assessments and constant risk mitigation to protect the patient from accidental injury. By identifying vulnerable patients and implementing environmental controls, nurses create a secure space for healing. Every protocol is designed to minimize potential threats to the patient's physical integrity during their stay. Fourth is hygiene and infection control, which extends far beyond basic cleanliness. It encompasses strict, evidence-based protocols like meticulous hand hygiene and the correct use of personal protective equipment, or PPE. These simple yet profound actions are the primary defense against the spread of dangerous pathogens within healthcare facilities. Furthermore, maintaining aseptic technique during invasive procedures is essential for preventing healthcare-associated infections known as HAIs. By adhering to these rigorous standards, nurses protect both their patients and themselves from cross-contamination, ensuring that the clinical environment remains a place of recovery rather than a source of new illness. The final pillar is safe medication administration. This high-responsibility function is governed by the rights of medication administration. This safety checklist ensures the right patient receives the right drug in the right dose, via the right route, and at the right time. Each right acts as a critical safety barrier. This process demands meticulous verification, cross-checking against physician orders, and precise documentation to eliminate the risk of medication errors. Nurses must remain focused and uninterrupted during this task, as even a small oversight in dosage or timing can have significant consequences for the patient's health and recovery. In summary, the fundamentals of nursing care are built on these interconnected pillars: the integration of compassion with science, precise patient assessment, an unwavering commitment to safety, rigorous infection control, and the meticulous process of medication administration. These elements work together to form a comprehensive framework for excellence. Mastery of these foundational elements is not optional. It is the cornerstone of safe, effective, and professional nursing practice. By consistently applying these principles, healthcare providers ensure that every patient receives the highest standard of care, leading to better clinical outcomes and a stronger, more reliable healthcare system.